Welcome to Dr. Tom Talks. Today, using the help of the biodigital human, I'm going to be talking about basal cell carcinoma and one of the treatments for basal cell carcinoma, Mohs surgery. So you may notice that I've got some bandages on my forehead, and that's because recently I was diagnosed with basal cell carcinoma. And underneath those bandages are the stitches and hopefully the scars that will go away from Mohs micrographic surgery. So what is basal cell carcinoma? Well, it's this type of skin cancer. In fact, it's the most common type of skin cancer, typically on the sun-affected areas like the face and the neck. And this cancer right here, as you can see here, it can get bigger and bigger. You may notice that it's a rough patch or slightly raised patch of skin or slightly discolored patch of skin. For me, I noticed that it was pinkish, it was dry, and it would bleed sometimes, especially when I got out of the shower and my skin was a little bit dry. And the thing about this cancer is it typically doesn't spread all over the body, but it can locally invade the tissue underneath. So it can get down all the way to muscle, fat, and even bone. And it may not look super deep from the outside, but if we make that skin transparent, you can see that it can really locally invade and get pretty deep into those tissues. So it's important that you get it looked at and treated as soon as possible. So let's zoom into the skin. So here you've got the various different layers of the skin. So here's the top layer. Here's the layer that you can see with your eyes and you can touch. This is the epidermis. It goes from the stratum corneum all the way down to the stratum basale. And that's what we're interested in, the stratum basale, because this is where this cancer starts. And in that layer, this is the dark layer here, are the melanocytes. And melanocytes produce melanin, and melanin gives us that skin pigment, gives us that dark skin color. So that's why it's dark here. And beneath that is the dermis, the subcutaneous fat, and the muscle. But let's zoom into that epidermal layer and see what's going on. So this is the very top of that epidermal layer, stratum corneum, and this is the stratum basale where the cancer starts. And what happens is typically it's because of sunlight, 2/3 of the time that's the case. These sunlight rays, they actually damage the DNA of the cells within the stratum basale. And they then become mutated, and those mutated cells, they just grow uncontrollably. They proliferate. And that's what cancer is. It's an uncontrollable growth of cells. So here you get those mutated cells right here. And if we zoom back out to see the other layers, so this is the layer that we were just in, the epidermis, that can locally invade. That can invade into deeper layers like the dermis and even down into the subcutaneous fat. And it can even go down into muscle, bone, lymph nodes, and so on. So how do you get this treated? Well, if it's quite superficial, if it's a superficial kind, you can actually get certain medication that you can put on, which over a period of days and weeks can remove the cancer. But mine was deeper and it was more common. And I had to get Mohs surgery or Mohs micrographic surgery. So I went to the University of Miami Medical Center, had a really great dermatologist, Dr. Rosen, and she did this procedure, Mohs surgery. And here it is. Here is the lesion. Obviously, mine was on my forehead. Here it's on the back. That was local anesthetic going in. And then using something like a scalpel, the lesion or cancer will be taken out, and it gets put under a microscope. And if there are no cancerous edges no cancerous cells at the edges of that specimen under the microscope, then they don't need to take any more out. Here, and in my case, they have to go back in and take a little bit more out until the edges are free of cancer cells. So if you zoom into this, we'll see a zoomed in version of this to the skin. You'll see here, the cancer gets taken out, but obviously there was cancer around the edges. And so they had to go in again, and they had to go in for a third time until when you put that specimen under a microscope, there are no cancer cells around the edge. So you remove all the cancer, then get stitched up, then you get a nice bandage on your head like me. So how do you prevent this cancer in the first place? Well, fairly obviously, limit your time in the sun, wear sunscreen, reapply, typically above 30 SPF, wear a hat, wear long clothes, and also, really importantly, go and see a dermatologist. If in doubt, check it out. If you've got something that doesn't look right, even if you don't have something that doesn't look right, maybe you can't see something on your back, go and see a dermatologist. They'll be able to tell you, and if needed, take a biopsy. If you need any more information, you can actually go to the American Cancer Society's website, which has all the information, including our nice 3D interactive content right here. Or you can go to biodigital.com. This has been a Dr. Tom Talk, and this has been basal cell carcinoma and Mohs surgery.